I'm Cindy. I'm doing my informative speech today on insomnia, which I think is something we all deal with, to where you cannot sleep at night. There's multiple types of insomnia that I'm going to talk about. Um, Insomnia can be just whenever that you go to bed, you can't fall asleep, or either you're waking up. And you can have acute or chronic. Acute insomnia is where, like, you've had some kind of change in your life, and it keeps you just to where you just can't relax your mind, shut it down, and just go to sleep. Um, and then chronic insomnia is to where you're having sleepless nights 3 days a week for 3 months solid. Then it's just classified as chronic. Um, and of course, if it's chronic, you definitely need to seek medical attention, because with lack of sleep, I'm going to go over and tell you how that affects your body as a whole. According to the 2005 survey from the National Sleep Foundation, about 30 to 60% of people deal with insomnia. It's more prominent in females, and as you age, it gets more prominent too. And how can we help ourselves to get into a better sleep pattern? Avoid things that are stimulants, which would be caffeine, nicotine, alcohol. Um, if you and don't eat a late meal, because if you go to bed with a real full stomach, you're just not going to sleep as well. So allow at least an hour, maybe 2 hours in between your meal and bedtime. So cook earlier than later. And whenever you're going to bed, try to get off of anything that emits blue light, which would be your cell phones, your computers, stuff like that, games, because they're stimulating, and then it just kind of keeps your mind going. So you want to eliminate all of that and get your mind ready to go to sleep. One of the main things that they say to do is have your bedroom completely designated to sleep and sex. So, to where your mind literally relates when you go to your bedroom, you're going to sleep. So, they suggest to keep your room temperature between 68 and 72 degrees. It promotes the most optimal sleep. Maybe take you a hot shower or a hot bath before you go to bed, just to kind of relax your mind, to get your body into a routine. Routine is the most important thing you can do, because your mind has to relate to a set pattern. And if you're actually getting up and going to bed at 8 or 9 o'clock, 10 o'clock every night, and then you're sleeping until 6 in the morning, that'll be enough sleep to actually help your body to reset. Because whenever you lay down to go to sleep, your whole body is actually just kind of shutting down, resetting. Just like our phones need a break, our bodies need a break, because whenever we go to sleep, that's whenever it really helps our bodies. And it's shown that with lack of sleep, you can have have a more increased risk of heart disease. You can have increased heart disease, and increased blood pressure, diabetes, stroke, obesity, and it weakens the immune system. And then you'll have daytime sluggishness, slow reaction time, or even immediate damage. By how many times have we heard that somebody fell asleep while driving, which is that's a big deal. Nobody wants to lose anybody because lack of sleep. So we need to take care of ourselves and make sure that you're getting to bed, and establish a routine that promotes sleep. And like I said, if you're suffering from lack of sleep, you need to get in a routine. If it's over 3 months, you need to talk to your doctor. And here's some handouts that I'm giving y'all, just with the information. Here's yours, Bridget. And one of the handouts is actually SpongeBob, when you're thinking about going to sleep, but now you can't go to sleep because you're thinking too much about going to sleep. And I think we've all done that, and we've watched the clocks. And here's another handout, and it's about tackling the insomnia symptoms. And it just kind of goes over and gives you some ideas on things that you can do to help yourself to get a good night's sleep. And here's another one, FYI, insomnia. Insomnia is the most common sleep disorder. People with insomnia usually have difficulty falling asleep, difficulty returning to sleep, or difficulty staying asleep. Some common factors that result in insomnia is stress, depression, anxiety, medical conditions, poor sleep habits, changes in your environment or work schedule. So we need to just try to get as much rest as possible. An adult needs 7 to 8 hours of sleep, and of course children need more than that. And here's another handout, and I have this all the time. My day starts backwards. I wake up tired and I go to bed wide awake. So hopefully we can get in a better routine to help ourselves, because our body needs to reset every night, because that's whenever your body actually starts healing from the inside out. And we all want to be nice and happy and good and not irritable and moody and weakened immune system. So we need to help ourselves to get more sleep. Got any questions? Thank y'all.